America's role, reputation and influence on the global stage is undergoing a transformation. Its vast aid programs, a sign of solidarity, a provider of life-saving services and a source of soft power, are being slashed by Donald Trump's administration. Here's what it means for the United States, its place in the world, and for people who rely on it in every corner of the planet. What does this Thai hospital treating conflict-fleeing refugees have in common with food distribution in famine-stricken Ethiopia? The answer: they both rely on the United States Agency for International Development, or USAID, which provides roughly 40% of all humanitarian assistance globally. It's financed disaster relief, women's health resources, access to clean water and anti-corruption efforts in dozens of countries. But much of that suddenly came to a grinding halt in February at the behest of the world's wealthiest man. Elon Musk, the unelected de facto head of the US Department of Government Efficiency, known as DOGE, has been tasked by President Donald Trump with overhauling government funds, and he's taken direct aim at the nation's leading aid agency.
If that just keeps going, we're essentially going to bankrupt the country. So what I really want to say is, it's not optional for us to reduce the federal expenses. It's essential.
USAID provided roughly $40 billion in foreign assistance per year. That's about 1% of the US budget. On February 3rd, Elon Musk posted to his social media platform X, "We spent the weekend feeding USAID to the wood chipper. Could gone to some great parties. Did that instead." Nearly all of USAID's 10,000 employees were let go. Many left stranded overseas, including in conflict zones. Staff in Washington took to the streets to protest.
USAID workers are just some of the most low-key folks that, the low-key but low-key brave, low-key courageous, low-key patriotic folks you will ever meet. They're not radicals.
Our jobs are gone, but hopefully the agency will remain, and one day we can come back and continue doing the work that we love to do.
Peter Boone has for decades overseen aid projects on the ground, and he says has seen American money go to good.
Trump and Musk have declared that AID and all of its programs have been fraudulent and corrupt and ineffective and radical. And it's just not the reality. It's just, there's no factual evidence of any of those things. We say we want to make America great. Well, I believe internationally, at least, AID and the international aid programs we've been running in the Peace Corps make America great in the eyes of many people.
Peter points to how HIV prevention in Africa saved tens of millions of lives and fears that ending such schemes could cost as many in the future. A withdrawal of financial support would hit the most impoverished nations, including South Sudan, Somalia and Afghanistan. Under pressure to resume emergency assistance, the Trump administration later conceded it may have rushed into things and lifted the freeze on some aid, but it did little else to back down.
We have, for example, turned on funding for Ebola prevention and for HIV prevention. Yes, correct. And we are moving fast, so we will make mistakes, but we'll also fix the mistakes very quickly.
So, do you see it as a worthy cause, USAID?
I think that there's some worthy things, but overall, if you say what was the bang for the buck, I would say it was not very good.
The USAID is really corrupt. I'll tell you, it's corrupt. It's incompetent, and it's really corrupt.
Elon Musk has led the charge to dismantle multiple other agencies, even though it is Congress which constitutionally should hold the power of the purse.
The key issue with Musk's actions is that it's happening in this zone that we could best describe as a gray legal zone, or perhaps more accurately described as a zone of illegality.
The 90-day foreign aid freeze and review period expires in late April, but much of the damage would have already been done, some of it irreversible. And with other countries and superpowers already being called on to fill the void left by the US, the American brand itself could be a casualty.
What's being signed there in America is wreaking havoc here in Africa. The biggest casualty so far is funding for the US President's Emergency Relief for AIDS, known as PEPFAR. Since 2003, PEPFAR has injected over $110 billion into the global HIV/AIDS response and helped some 25 million people, mostly in sub-Saharan Africa. But other critical health services are at risk for programs targeting malaria, mpox, tuberculosis, even reproductive health care. Here's a look at the fallout in Africa from the White House order to freeze foreign funding. For people living with HIV in this Abuja community, free medication and access to vital services are a lifeline. Here, many people struggle to live on less than $2 a day. Even a single meal is a luxury. Their survival is highly dependent on support from humanitarian aid.
So focus more on HIV testing.
Abdul Qadir Ibrahim is the national coordinator of the Network of People Living with HIV and AIDS in Nigeria, or NEPON, a beneficiary of U.S. support.
It has really impacted NEPON because we have a very unique program that we run with the U.S. government through the PEPFAR office, which is PEEP. PEEP stands for Patient Education and Empowerment Program because it's basically meant to strengthen and equip the PL-HIV community with the knowledge to be able to demand access and their right and dignity in terms of HIV treatment.
A beneficiary of NEPON's support, Helen Afan has lived with HIV for the past decade and has depended on free antiretroviral drugs that may no longer be readily available.
Imagine I'm not able to access or to buy this antiretroviral drug. Do you know the impact it will have in me? From time to time, I'll be falling ill because I'm not regular on the antiretroviral.
The U.S. Embassy in Nigeria shows that as of 2023, PEPFAR had disbursed over $7.8 billion to ensure Nigerians living with HIV and AIDS had access to proper HIV prevention, care and treatment services. But it's not just HIV programs on the line. Nigeria also faces a high malaria burden, with authorities estimating around 55 billion cases each year. The U.S. has played a crucial role in supporting Nigeria's efforts to reduce this prevalence. Last November, USAID committed $2.3 million for the purchase of life-saving malaria medication, but this vital commitment is now in jeopardy. Nigeria is among the top 10 recipients of USAID funding. Also on that top 10 list is Uganda. Already home to 1.4 million people living with HIV and AIDS, family planning and reproductive health are also now under threat, with organizations like Marie Stopes looking for other options to keep services up and running.
We are stretching the resources that we have to bridge the gap. There's no doubt that USAID is a big donor. We cannot fill the hole, but we are present and doing what we can in partnership with our respective ministries of health. MSI globally is losing $14 million in this season. The worst hit country is Zimbabwe. Zimbabwe is losing $9 million out of the $14 million because USAID had awarded them a program in 2023, and it was a 5-year program.
America's pause on foreign aid funding has also raised questions about the future of U.S. support for global health programs. But health experts say this also creates an opportunity for African countries to find domestic solutions and reduce their reliance on foreign money.
We need to really do inward looking. We need to now begin to strengthen, the institutions in this country. We need to be able to now, imbibe policies, strategy, etc., that can enhance, robust, economy and, guarantee proper funding, for critical sectors of the economy of the country. And one of them is healthcare.
Countries like Nigeria are already making moves towards some measure of self-sufficiency. The government has greenlit $1 billion to reform the healthcare sector. There are also plans to produce HIV test kits and antiretroviral drugs domestically before the end of the year.
Nigerian government under the president is looking towards transforming the sector that is nationally owned, using national systems and using domestic financing as well as other sources of financing to ensure that those who are on treatment do not lose the treatment that they are already on.
While these short-term measures offer relief to people living with HIV/AIDS like Helen, the reality is there's still a long way to go for Nigeria and Africa to find long-term remedies to their public health challenges.
In trying to determine how far-reaching the USAID funding has been, CNA's teams around the world spoke with numerous NGOs and aid workers. Fearing reprisals from the US government, many of them declined to speak openly with us on television. Here are the people who did. Dr. Jeffrey Tabin is the celebrated eye surgeon who cures blindness in some of the world's poorest places. Much of his work involves cataract surgery in Asia and Africa. But he now finds himself without the tools he needs to operate.
We have a huge number of poor people who are blind and in need of eye services. And the one problem we're facing is that we don't know what to do because the funds have been frozen. We've been told by USAID to halt all work. One of the nicest things that a wealthy country can do is provide, life support for people who need it and, urgent medical care for the poorest countries. And are we becoming a completely changed, self-centered kind of nation?
In Thailand, an NGO that conducts HIV research and provides health services for transgender communities is being forced to cut staff pay and shutter office space.
In terms of staff costs, renting costs, we have to say that around 40% of our staff salary and renting costs have been paid by USAID money. So that means that now we immediately don't know how to pay for the 40% of staff costs and renting costs. We will have to close down our office space, try our best to continue operating our clinic services.
Climate change projects are also in the line of fire.
We are seeing already billions of dollars clawed back that was committed under the past administration to help poorer countries to get through not just the development that they need to avoid emissions in their countries, but actually deal with these mounting crises that they are facing. We are moving into the hurricane season. We are moving into the summertime when there's expected to be even worse and prolonged droughts, and there simply will not be enough money to go around.
The impact has also hit civil society and youth groups, muffling voices from Serbia to Pakistan.
Syed Faisal Shakil is an aid worker in Pakistan who can no longer aid. Part of his work involved educating citizens and communities about their democratic rights.
It came as a surprise, to be very honest with you. I had a year-long contract with the organization.
Overnight, his contract with the USAID-funded Trust for Democratic Education and Accountability was terminated.
I asked them about, renewal of the contract. They said they won't be able to do that because the funding has been paused. People are suffering, and people that I know, they're looking for jobs.
Government sources have told CNA 39 major ongoing projects in agriculture, human rights, and education have been paused in Pakistan.
Legal aid for anti-corruption protesters in Serbia, support for independent media in Moldova, and assistance for pro-democracy youth groups in Belarus. These are just a fraction of the youth programs in the Balkans hit by Washington's decision to halt foreign aid.
There's been a almost overnight change in the way in which these programs are funded, or the fact that they're not funding, they don't receive funding anymore, and some of them have had to stop.
The European Youth Forum represents over 100 youth organisations across Europe. In Serbia alone, roughly $80 million worth of funding is on the line.
This really affects the ability of these organizations to organize, to support activists, to support these kinds of projects that keep the principles of democracy going in countries that need it the most. And again, this is just gone, just like that.
And there's been some reaction from the likes of supporters of the Trump administration saying things like these are a left-wing NGOs push for radical policies. What's your response to these kinds of statements?
We have people, citizens, activists who fight for these values that the United States have stood for hundreds of years, and we see that crumbling away and being labeled somehow as a radical left-wing agenda.
The European Union warns it can't fill the funding gap alone. Voiku says it's a matter of political will.
The EU, because there have been alternative sources of funding, like USAID, for example, so far, has not taken this duty and responsibility to support independent civil society very, very seriously.
Aid groups say the impact of Washington's funding freeze should be a wake-up call for the EU to step up and support organisations working to make that goal a reality.
The World Health Organization has a simple mandate: oversee public health around the world. But its work is hardly simple. Under its United Nations remit, the WHO has to navigate crises and politics to get to places people can hardly get to, much less want to go to. But the US president is pulling America out of the world body, taking with it hundreds of millions of dollars in critical health funding. Now the world is bracing for a crippling blow, one that Americans themselves may not be able to avoid.
We regret the announcement that the United States intends to withdraw from WHO.
The World Health Organization is in the business of life and death. It distributes polio vaccines to war-ravaged Gaza and helps with mpox outbreaks in the Democratic Republic of the Congo. It immunizes remote communities in Mexico against measles and treks through rural Indonesia to deliver medical supplies. But a decision made more than 15,000 kilometers away has put all that work in doubt.
And we paused $1.7 billion in unauthorized payments to foreign organizations, including stopping more than $40 million that was on its way out the door to the very corrupt World Health Organization, which has not done its job and not done it properly.
President Donald Trump has put the WHO on notice, formally withdrawing America from the agency. The move goes into effect January next year, but it's already sent shockwaves around the global health circuit, from Africa to Asia.
Southeast Asia, where, 1/4 of the world's population lives, WHO has been very, very important in terms of, vaccines, setting standards, giving technical assistance around maternal-child health.
Washington was expected to contribute nearly $960 million to the WHO's 2-year budget that ends this year. That's around 15% of the about $6.5 billion it needs.
We're going to see a reduction in childhood vaccinations together with UNICEF. We're going to see reductions in the provision and the coordination of aid in places like Gaza and places like Sudan. And sadly, I can go on and on.
We're saying, let's not worry about as much about non-American lives, basically. And in fact, that's not the way to lead our life as human beings.
But Washington's WHO exit would also leave Americans exposed, especially when it comes to sharing crucial information about emerging health threats.
Disease is not controlled by borders, and it's enormously dangerous for us to be thinking we can just be out there on our own.
As a WHO member state, American health officials can lean on the agency to access data about infectious disease outbreaks the US may need to prepare for, and to keep American travellers aware of health risks.
If the US is not sufficiently informed about what WHO is doing in all those countries and those regions, they're going to be less secure because they're not going to have all of that information.
In January, US public health officials were instructed to stop working with the World Health Organization. Information sharing between the US Centers for Disease Control and Prevention and the WHO went dark.
Even though we can sort of monitor our own public health setting, we need that global monitoring for the things that are coming our way. We're one planet, as pandemics have taught us several times.
But America's issues with the agency are not entirely without merit. Mr. Trump's biggest complaints are that the WHO mishandled the response to the COVID-19 pandemic and that America's payments to the global health body are much more than others, including China's. The WHO has also long faced criticism for being too bureaucratic, too slow to act, and too lenient on countries that don't openly share information.
America's withdrawal from the WHO was just one salvo in its offensive against foreign assistance and international agencies. The exit comes on top of Washington's suspension of USAID, as well as its withdrawal from the UN Human Rights Council and the Paris Climate Deal. It also won't resume funding the UN Agency for Palestinian Refugees, known as UNRWA. But in backing away from the global stage, experts say America is ceding a principal role on that multilateral platform and its ability to influence other countries with goodwill rather than with coercive pressure.
And that leaves room for other players to fill the void and assert their own soft power. Eyes are already turning to China.
世界卫生组织作用只应加强，不应削弱。中方将一如既往地支持世界卫生组织履行职责，深化国际公共卫生合作，加强全球卫生治理，推动构建人类卫生健康共同体。
As world agencies brace for further US cutbacks and lockouts, eyes are on who else can fill the void. Other major world powers like the United Kingdom and European Union have been called upon to do more, and observers say that could pave the way for a paradigm shift in soft power dynamics among the world's largest players at the cost to America.